Greetings everybody, Adam Hires here, Hires and Associates. As promised, here's the video where we can take a look at the prescription drug plans. As of the making of this, it's open enrollment, but some of this applies year-round if you're new to Medicare, moving, etc. You've got a link in the email that I sent you if you're a client of ours. If you're not, you can just Google Hires and Associates Insurance. Go to the Medicare tab, click on Part D Drug Plans. You'll see there's two options here: Compare Plans Now, Request Agent Assistance if you're not sure. Let's compare plans now. All right, I'll take myself off. I recommend clicking on the left side here, Help Me Choose. Put in your zip code. I'll put in ours. And at this point, you're putting in your prescriptions. So let's say you take levothyroxine. It allows you to enter the first 3 letters. Then you have to scroll down to find the prescription that you're taking. Levothyroxine, maybe 25 micrograms. You take it every month, once a day. Add drug. Maybe you take, or you think you take, Crestor. So you put in Crestor. You see it comes up, 20 milligrams. But wait a second, there's actually a generic for Crestor. This makes a difference. If you don't put in the generic, you're going to get some results that are off if that's what you happen to be on. So let's switch to rosuvastatin calcium. That's what we take. It's actually 10 milligrams. Every month we take 1 a day. Add drug. And then maybe you take metoprolol. So that one is a little further down the list. Lots of prescriptions starting with MET that are out there. You see there's 2 kinds. This is important too. Make sure you're choosing the correct one, succinate or tartrate. And then enter that you take that every month. Maybe you take that one twice a day. So we would add that prescription, so on and so forth. You can add your entire list until you're done. Once you are done, click Next. It's going to ask you about your doctors and so forth. You really don't have to put this information in here. We can skip it unless maybe you're looking at Medicare Advantage plans. Many of you are just looking at standalone drug plans that pair with your Medicare Supplement insurance. So we can skip your health. We can skip your doctors. This is important though. It's going to talk to you about pharmacies here. You can search within distance. If you're in rural areas, you can expand your search. You can also look by pharmacy name if you want to. So there's a CVS and Kroger near me, so let's just say I go to Kroger. Let's click Next. Now you can go back and change this, and you may want to, because some pharmacies are preferred, some aren't. This next option allows you to put in the current plan you're on if you want to. You certainly don't have to. It muddies the waters a little bit in my opinion, so I say skip that. Okay, need help comparing plans? No, not necessarily. This video is going to explain to you how to do that. So once you're here, you're actually at the results. It defaults to Medicare Advantage Part D drug plans. For many of you, that's not what we want. We don't want Medicare Advantage plans either. These are Advantage plans that don't include drug plans. We just want standalone Medicare Part D drug plans. Okay. You can see it's defaulting to 2021. It's open enrollment. Today's October 15th. But this works, like I say, year-round. What comes up first? Aetna. Aetna has a really good plan here for this coming year. It's the SilverScript Smart RX plan. It is $7.30 a month. That's the lowest prescription Part D premiums we've ever seen. It does have a deductible, like many of these do, but oftentimes the deductible does not apply to what you're taking. So it tells us what the estimated annual costs are. This doesn't include necessarily the premiums, but you can see there's a big difference between this Aetna plan and the very next best plan, WellCare. So let's click on Details here and let's learn more about our plan. I recommend clicking on Drug Cost Details, and this is going to tell us some important things right from the get-go. The first thing it tells us is our pharmacy status. This is preferred retail. That's what we're always going for. You want a preferred pharmacy. If this comes back standard, you may need to change your pharmacy or consider changing pharmacies if it saves you some money. That's up to you. As we scroll down, it tells us what the actual cost of most of these prescriptions is, just a couple of bucks. But when we get to the actual cost when we're on the plan, we see all those prescriptions are zero. They're all Tier 1 generics. The deductible does not apply. So we just pay our premiums. So that cost before actually did include the premiums, and all 3 of these prescriptions are zero. And it tells you what they're going to cost. So let's go out into November, December, nothing changes. So you never get to the kind of quote-unquote donut hole or catastrophic phase. They've changed the those a little bit. But if you're on some more expensive prescriptions, you want to go down and search these months to see if you reach some of these phases, because the first thing you have to do is get through to the deductible phase, and then sometimes when you're in these catastrophic phases and so forth, you can see these numbers change. So I encourage folks to go out a little bit if you're on expensive inhalers, insulin, some diabetes drugs, things along those lines. So this is all helpful, but as we go back here, we can go back to the previous page. We might remember, you know what, actually I get something for my allergies, kind of a seasonal thing. I forgot to add a medication. So let's add a new one. Maybe you are on albuterol, sulfate. Maybe you take that nebulizer. You get this container, but maybe you get it only every 6 months, approximately once a year. All right, let's add the drug in there. So now we see that's in our list. That's good. We want to go back to plans. Okay, we can skip what we're currently in and see if that changes things at all. In this particular instance, it really doesn't. It's just one prescription once a year. So that you can see the estimated annual costs have gone up a little bit. Now, we already know that Kroger is a preferred pharmacy, but maybe we just don't like going to Kroger. It's not convenient. Okay, we can change pharmacy, go back and say, well, actually I prefer CVS. It's a little bit closer. So let's put that one in there. And then let's view plans again as this loads up. Well, still the same cost approximately. SilverScript and Aetna are working together. Now Mutual of Omaha comes up with their new coverage. So again, switching in and out of pharmacies can be helpful if you're not sure. Now, most importantly with all of this, you're going to get a code up here at the top. Copy that code down, write it on paper, copy and paste it. You can email it to me. You can let me know what you see. Not every single plan available is in our software here. Cigna's not in here. Express Scripts is not necessarily in here, although some of these insurance companies use Express Scripts for mail order. They have their own particular plans. They don't sell through agents. So if you're on some more expensive prescriptions, the Cigna plan or some of these others might come up better for you. And so if you put in this code and then maybe go back to our website, and let's see here, you could just email us, click email, send the code. Most of you have my email. Just let me know what you're seeing. You can click contact us, etc. Put in your code. I can look at everything for you and happy to do so. Because again, we don't want to assume everything we see is accurate. You may want another set of eyeballs on this. But let's assume that you like, again, everything that you see. Okay, this Aetna Smart RX is going to come back great for a lot of folks. Click Enroll. All right, you can do this right on your own. You're on your way. This is the application. You put in your information. You'll want to have your Medicare card handy. You need to put in your new Medicare number that came out within the last couple of years. It's going to ask you how you want to pay for it. I recommend doing a coupon booklet. You can set it up on monthly bank draft. It takes about half the time. It doesn't always work. So if you select coupon booklet, you'll also get the information to set it up on bank draft. But this plan here is so inexpensive, $7.30 a month. You might just get a coupon booklet and write a check for all 12 months for the whole year and be done with it. Because the way drug plans are going right now, we may have to do this again and again every year. Who knows what the next SilverScript Smart RX plan will be for next year. Could be with a different company. They're changing fast and furious. And if you hold on to that code that I mentioned, if you put that code in next year, you'll see that all of your information comes up again. You only have to adjust if you have any new prescriptions. What else? You put in the cost, you put in how you want to pay for it. And you also want to put in that it's the annual election period. Vast majority of you, that's what it will default to. It will say, why are you enrolling now? Well, it's October 15th through December 7th. I'm just switching drug plans. So it's AEP. Now, if you had moved or you're experiencing a qualifying life event or something along those lines and you're not sure, just let me know. Some of you may have found this video and be new to Medicare, and it might default to new to Medicare based on your age. But if you're just not sure what to put in, it's important that we get that right. Again, right now for these purposes, it's AEP. So you put in all your information and you just go through page by page and click continue and finally submit. If you're having trouble, my phone number's on here. Just give me a call. I'll be available working day and night here through December 7th until this ends. And again, you're on your way. But especially if you're not sure about what you're seeing, this code is the most important thing. Just email it to me and hold on to it. It's going to be helpful going forward, especially if you have a long list of prescriptions. So that's kind of how you do it. Again, I'm going to put myself back on the screen here. So Adam Hires and Associates. Shameless plug here, we do a lot more than just Medicare. A lot of people are asking about annuities right now in terms of just getting some better returns on what the banks are paying. They're not paying too much. We do health insurance. If you have some children or something like that are looking for health insurance, long-term care, life insurance, wealth transfer, quite a few things. But if you have any questions about what you're seeing here, just let me know. Feel free to call and be happy to help. Okay, thanks for watching our video here, and hope you find this helpful, and look forward to working with you. Happy open enrollment.